Welcome to the Perry Health Pulse podcast, a program dedicated to taking you behind the scenes of healthcare, sharing firsthand knowledge from healthcare professionals, and putting you in the driver's seat on your journey to lifelong health and wellness. Listen and learn about how healthcare delivery is changing on our weekly podcast.
For today's episode, we're bringing back Tim Schultz. He's the Director of Respiratory Care here at Perry. Here because it's Respiratory Care Week, the third week of October, and we want to highlight some of the things that are our major focuses of respiratory care. Tim's been doing it for over
21 years.
21 years, so he's got a lot of experience in the area, and glad to have him back. Thanks for joining us, Tim.
Thanks for having me.
So our focus today is a little bit more on on sleep disorders, because that's something that a lot of people either experience or they might experience and not know that they're really going through something that they need help with. So let's start out. What sleep disorders do you see? How common are they?
The biggest sleep problem that we encounter in our work is obstructive sleep apnea. That is a problem where patients' airways will kind of collapse when they sleep, shuts off the airflow, and they have pauses in their breathing, which is called apnea. So this happens in varying degrees. Some patients have a real mild case of sleep apnea that there's treatments that we can do. Others are more severe, and then we have other a little more serious treatments that need to be done to treat those problems. We do see patients with restless leg syndrome, and that causes problems because and many people have experienced this at times where you're just about to go to sleep and your leg jerks, or you feel a kind of a creepy, crawly feeling in your leg and you just have to move it. That happens to all of us. But with restless leg syndrome, people have this chronic feeling of that. It really messes up their sleep patterns. Sometimes they have trouble getting to sleep. Other times they wake up because their legs are restless and maybe they're kicking their bed partner. A lot of these sleep disorders, people may not know that they're experiencing this unless their husband, wife, significant other point out that, oh my gosh, you're kicking me in the middle of the night, or you're snoring so badly that I can't sleep. And sometimes the partner will even report that the patient is stopping sleeping, that's when it gets serious.
Now, in your 21 years of experience, are there any trends that you've seen, things that are happening more often now than used to happen?
Oh, definitely. There's a lot more awareness now about sleep apnea. 20 some odd years ago, it was known, but people weren't as aware about it. It wasn't in the news. This might get found on accident. So I think the big difference is the awareness that this is a serious health condition and that there are some very serious long-term effects on the body for people with untreated sleep apnea.
Now, obviously, if you're not getting enough sleep at night or you're not getting sound sleep, that's going to impact your life in other ways too.
Oh,
what
sure.
are some of the things that can lead to?
Oh, gosh. Well, falling asleep at inappropriate times. People are at work at their desk and nodding off. Obviously, that's going to cause problems. The boss comes by and you're asleep at your desk. But even more serious than that, it's increased risk of car accidents. A lot of patients with severe sleep apnea fall asleep while driving, while in the middle of a conversation. Most of what we see isn't quite that severe. However, just being drowsy throughout the day or waking in the morning, getting out of bed and just dragging through. You just they wake feeling unrefreshed, like they hadn't been to sleep at all last night. And the reason why people feel that way is when they have sleep apnea and their breathing pauses, your oxygen levels in your blood will drop, your carbon dioxide levels rise, and your brain, in fact, to get things going again, causes you to arouse so that you will start breathing again. Now, the thing is, people will say, well, that's not me. I don't wake up in the middle of the night. Well, they may not know that they're waking up. And what they're doing is they're coming out of a deep form of sleep, maybe into a very light form. Or maybe they rouse for a moment or two, snort and cough, roll over, and back to sleep. They're not even aware that this is happening. So that's where A lot of these problems, as I said before, are reported by family members, people in the house that hear this going on. But that happening all throughout the night, a person never gets good restorative sleep. And that's where we see the problems of constant tiredness, falling asleep at inappropriate times, and risking potential for car accidents or losing your job.
Now, is this something where, you go one night without having a good sleep and then you're tired during the day and then you don't get another restful sleep? Can it compound over time?
Oh, absolutely. Yeah. As I said, for some of our patients with more severe sleep apnea who've had it for a longer period of time, they kind of get used to how they feel. They don't see anything wrong. Other people will notice, maybe they just don't have any gumption at all. Maybe they used to be an active person and now they get home from work, they plop down in the recliner and they're done. They want to eat and they want to go to bed. If people are noticing lifestyle changes like that, formerly active people that are now, it's all they can do to get through the workday, and they want to go to bed.
Well, and that I could absolutely see affecting mental health as well, just adding to being depressed, not being able to do the things that you want to do in life. And
absolutely.
So that would be a major concern too. Let's pause for just a moment to hear a message from today's sponsor.
Mammograms have come a long way, baby. Perry Memorial Hospital is home to the 3D mammography, proven to detect breast cancer 15 months earlier than conventional mammography alone. Schedule your mammogram screening, 815-876-3313 or 815-876-2050. To learn more about 3D mammography, visit perrymemorial.org.
So at what point should someone decide, I'm really not getting enough sleep, I need to get help?
Actually, there's some things that people can do. It's hard to, being the person that this is involved with, differentiate. Am I having sleep apnea? Am I insomniac, having insomnia? So there's some things that you can do at home to try and better prepare yourself for a good night's sleep. And a lot of these seem like really common sense things, but we're all so busy in our lives that sometimes these things kind of slip by. So one of the things, you really should only go to bed when you're sleepy. Some people, if they know they have an early morning, they try to go to bed earlier, and you lay there and you toss and you turn, and that is not recommended. If you are having trouble getting to sleep, it's recommended that you get up, get out of the bed, maybe go read a book for a few minutes, have a glass of milk, and try to get yourself into a more relaxed state, because I myself have had problems going to sleep, and I know if I toss and turn, and pretty soon you're getting angry, and that's not conducive to sleep. But some real simple things: cover your alarm clock or turn it to where you can't see it. People who are having insomnia tend to look at the clock. It just upsets them that I've been laying here this long and I'm still not getting to sleep. Regular exercise is highly recommended to deepen sleep. Now, there's a caveat to that. You do not want to exercise too late in the evening, because that will get you worked up and doesn't provide...
I guess a little adrenaline flow.
Exactly,
keep you up.
exactly. So it's recommended to have regular exercise. I wouldn't do anything too strenuous after dinner time. A nice casual walk in the neighborhood might be fine, but I wouldn't go to the gym and work out, after dinner time. Keeping the temperature moderate in the bedroom. A warm room can sometimes make it difficult to sleep or may disturb sleep. We recommend keeping it nice and cool in the bedroom, maybe using a fan. If you have a ceiling fan, get used to some of that white noise. That sometimes helps people. Try not to take your problems to bed. We recommend to a lot of people, especially if you're in a stressful time in your life, before you go to bed, sit down and write a list for the next day. Sometimes writing stuff down can get it out of your head and makes things more conducive to getting to sleep. Those are just some of the real easy tips that people can try at home. Now, if you've tried all this and you're still experiencing problems, or you're not getting restful sleep, then it's time to maybe make an appointment with your provider and just explain to them what's going on. Most providers will screen patients. There's a questionnaire they'll ask you about how well you sleep, what's going on, and then they'll combine that with their examination and decide whether or not maybe a sleep test would be indicated to help figure out what's going on.
Well, and in our last episode about Medicare wellness visits, one of the things that Trudy brought up is that with the questions they go through in those visits, a lot of times what comes out is people are having trouble sleeping. That's a big thing that comes up. So having that conversation with your provider can then lead to getting the right help that you need. So let's say that does happen. Someone brings that up to their provider, get a referral. What's the process after that for diagnosing and getting help?
There's a couple of different things that we offer for getting the diagnosing done. We have in-lab sleep tests where the patient comes in the evening. We have a sleep laboratory right here in the hospital where they will come up. We will get them all set up. There's a sleep tech there all evening in an adjacent room monitoring all sorts of parameters that we're looking at: heart rate, breathing rate, oxygen level, heart rhythm, brain waves, all these sorts of things to help keep an eye on what's going on at night and figure out if we can decipher what's happening. We do also offer a home sleep test, which is much more simpler testing, and it's a great tool to help to diagnose sleep apnea, maybe for patients who are a little bit apprehensive about coming into the hospital overnight. So we do offer that as a gateway to kind of get someone diagnosed and figure out what we need to do from there. A lot of times, whether it's an in-lab or a home study, that's kind of a preference of the provider, and also nowadays insurance usually has some say in that as well. Some insurance companies will default to a home sleep study first to make sure that that's looked at before having someone come in to the hospital for an overnight study. The advantage to coming in for an overnight study is if we find by a certain time of the evening that a patient does have sleep apnea, we can apply the treatment for that, which is a CPAP mask, all in one night. And sometimes we can get everything done all at once, have the exact prescription for what needs to be done so that the patient can return to their doctor and get an order for a CPAP machine.
Now, speaking a little bit more about treatments, can you just go through a little bit for each condition? What would be a common treatment? Is it medications? Would it be different tools needed? Or
Sure. For the most common, the sleep apnea, depending on how severe it is, for some very mild sleep apnea patients, it could just be positional therapy. Sometimes the patients may get a bed wedge to raise the head of their bed because sleep apnea tends to be worse when people are laying flat on their back. There's also, and this is an old school treatment, people used to sew like a tennis ball into the back of their pajama shirt so that they wouldn't ever, if they rolled over on their back, they wouldn't stay there. I don't see too much of that anymore. But with the moderate and worse sleep apneas, the gold standard of treatment is a CPAP machine. And I think probably almost everyone out there knows somebody who uses one of these, but it's basically a pressure generator with a tubing that connects to a mask that patients wear through the night. And what that mask does is it adds pressure into the airway, enough pressure to keep that airway splinted open so that they don't have the airway collapse and the subsequent apneas that happen when that does. So there are, depending on the severity, there are other types of CPAPs or BiPAPs, which that's a couple different pressure levels, and that's more for some of our more severe types of patients, or patients that have what's called a mixed apnea, where it's not just because their airway is obstructing, but sometimes people have a problem where the brain doesn't send the proper signal, and patients will stop breathing because of that. In those cases, those types of patients need a little more serious type of machine. Still get it through the same process, the same exact process, and through a home medical company would supply that. When it comes to your restless leg syndrome, that's more of a medication type of therapy. So if a patient comes in and it's found that that's their problem, that their legs are jerking all night and waking them up, there are a couple of different prescriptions that the provider can choose and try that out and see if that helps.
now with any of these, is there Does there come a point where a patient won't need those things anymore, or is it kind of they need it to manage it the rest of their lives?
Most times they're going to need it to some degree for the rest of their lives. The only difference being sometimes when patients are carrying too much weight, extra weight can exacerbate and worsen sleep apnea. So there have been cases where patients have lost a significant amount of weight. They feel like they don't need it anymore. And we see them back in the lab, and we'll do a baseline study on them again and check them. Sometimes they need it, sometimes they don't. Really depends on the individual. More and more we're seeing that sleep apnea is more about anatomy. However, being significantly overweight can also cause that to be worse. So sometimes patients are very motivated. They don't want to have to wear this mask. And if they lose a bunch of weight, start exercising and get in good shape, they may not have to have it. Most times, it's usually a lifetime thing, though.
Sleep disorder is obviously just one part of what the respiratory care team does here. Can you just kind of give an overview of all the services you provide?
Sure. Big majority of what we do is provide breathing treatments for patients with COPD and asthma and all sorts of different things. And these treatments involve having patients inhale medications to help open up their bronchial tubes, to ease wheezing in asthma and to decrease shortness of breath. We also do provide all sorts of different therapies to help loosen phlegm, mucus, and secretions in the lungs when patients have pneumonia or bronchitis. We provide mechanical ventilation services in our ICU. So if patients are really having difficulty breathing and they're not able to breathe well enough on their own and they need to go on a ventilator, our department takes care of managing those, as well as CPAPs and BiPAPs in-house, inhalers, and we draw blood gases. So blood gases are something that doctors can use to check your lung function by sampling blood from an artery, and we can check the oxygen level, carbon dioxide, and all sorts of other things to help the provider to see where the patient's at and to make a diagnosis.
All right. So even though this week is Respiratory Care Week, it's important to recognize all those important roles all year long and think about that list of techniques for if you're having trouble sleeping, things to try, and then from there know whether you need to go seek help. So thank you so much, Tim, for joining us.
Well, thank you.
It doesn't stop here. Access other podcast episodes and resources related to today's episode by visiting www.perrymemorial.org/podcast.